My wife is a patient of yours. She comes in for routine screenings, and it's awesome technology. My question is, are you going to train anybody? Like, is there anybody in other states? We're going to be moving to Florida. Now, does that have to be approved by like the Florida Medical Board? Why isn't this available in other states?
Well, actually, it is. First of all, there are 10 young doctors around my office waiting for me to retire, and I've taught most of them how to do this in case I take a long vacation. So it's available in Florida. By the way, I'm setting up a clinic in Tampa with some of the doctors working with new technologies. So this is available remotely. Look, I do telemedicine. That's how I was able to write the textbook on COVID. I don't know if you know it, but it's on Amazon. It came out in August because I was working remotely with the Europeans and the Japanese. We were able to image people and put a textbook together on COVID, which affected lungs and it affected actually everything else. It was a big cause of stroke. So we got into stroke imaging, but yeah, there's a lot of good ultrasound in Florida. We have a program to train people to do other things. As a matter of fact, let's see, we train people. Yeah, look, we give teaching courses. All the ultrasound programs give courses worldwide in training all of this. The last one was in San Diego last month. So I presented there. So there are organizations that teach people how to do it better. The most important thing is realizing there are many options that are available that even doctors don't know about. I learn new things every day. For example, yesterday I learned that you can use near infrared light to treat heart disease in pediatric patients because it penetrates the skin, and infrared or the optical wavelengths can heal. We're using things like pulse electromagnetic technology. I think I have it back here. No, I don't. There are many, many treatment technologies that are available diagnostically in treatment that can be used. You have to be aware of it. For example, when we looked at a technology to treat horses, it was brought into my office, and one of my patients had a dog with her. So we put the dog in the electromagnetic coil to get better, and the dog calmed down and the pain went away after treatment. So we put the same coil for the horse on the lady's shoulder from pulling a big dog, and the shoulder got better. So there are many, many options available if you just look and ask and question and don't settle for whatever you're told.
Thanks very much for that, Dr. Bard. And now, and yes, Kim, thank you. I see that your audio is there for me now. I don't know what happened last time, but we are pleased to welcome you now. Hi, Kim.
Great. Thank you so much for this presentation. I'm a daughter of an aggressive stage 4 prostate cancer, my dad, and I've been trying to help him research and, kind of navigate this over the past 2 years. He's a patient at the Smilo Cancer Hospital Center in Hartford, Connecticut. And first of all, I would love to know possibly how he could become, a telehealth patient of yours. But just for a little bit of background, his PSA before he started treatment was 80. It jumped like dramatically over the course of 6 months. But thankfully, after chemo and he still is actually on Xtandi, it brought it down his PSA to 0.5. But it's been slowly creeping up over the past 6 months, and it's now 5.8. So he just went in for an MRI scan. And the cancer, actually, he completely changed his diet. He's completely vegan. He exercises. He's honestly in the best health of his life, except for the cancer. And many of the cancer spots have disappeared, thankfully, but now he has 2 hot spots in his right hip and his 6th rib. So we are meeting with a radiologist in another week to discuss treatments. But with all that being said, is it just a signal that there's nothing more that they can do, that the Xtandi just won't work anymore? Or is there any advice you can offer?
Yeah, okay, here are some options. Image-guided treatment has been done for a long time, and Smilo in Connecticut it's a great institution. If it's focally in the bone, you have the option for focal treatments. So there's a possibility of embolizing the vessel that goes to the tumor site if it's local. There's focal radiation. There's new oncoimmunology, where you target the genes that would go to, or the cells that would go to the tissue area. So look, there are treatments. The best thing is being in good health, because then your body fights cancers. I remember when I first started, I had a woman with stage 4 breast cancer, and she had it everywhere in her body. And, you know, I said, look, there's nothing I can do for you. Good luck. I had the same woman came back 9 months later, and I didn't recognize her. I said, why are you here? She said, don't you remember me? She was the one who had cancer everywhere. She was unsalvageable, and she did alternate healing and prayed and whatever, and the cancer went away. I couldn't believe it. So the body has healing powers that are unbelievable. If you look, hope is one of the better treatment options we have. And when somebody tells you you're going to die, or you have 6 months to live, and it can't be done, find another option. We saw this specifically. I had a lady from New Jersey. We were doing just a routine pelvic scan, and I found the cyst, and it looked malignant. And then we found out later that she had breast cancer that had gone there. And once the doctor told her it had spread, she gave up hope, and she died within a month. She just gave up. So don't give up, fight, and live the best life you can.
Sage advice. Thank you very much for that, Doctor. And with that, we're now going to move on to Kathy. Hi, Kathy. Welcome.
Hi, can you hear me?
We can. Thank you.
Okay. My daughter is 35 now. When she was about 16 years old, she experienced repeated pneumothoraxes. And after so many occasions, then the doctor suggested a thoracotomy, which when she went in, she cut into her lung. The lung didn't collapse. And she said, had she tugged on it, my daughter would have bled out on the operating table, because there was a blood vessel at the top of her that had formed at the top of her lung and was attached to the top of the lung. And at the time, we didn't think, we were like, wow, that's pretty cool. But we had no idea that blood vessels were a sign that, wasn't a good sign. Blood vessels in areas that, you wouldn't normally expect them. So we didn't think anything of it. We went on and she's 35 now. She recently had several miscarriages and finally a successful pregnancy after having taken lots of hormonal type injections. And now, after hearing a lot of these virtual presentations since the pandemic started, I'm learning more and more about different things, including, these blood vessel formations. Should we be concerned about, anything going on inside of her?
Absolutely. First of all, the point you're making is important. Blood vessels can be anywhere. This is especially true when they're doing plastic surgery or cosmetic treatments around the eyes. There's a major cause for blindness because if you put Botox or a filler into one of the myriad vessels around the nose and the eye, it can cause blindness. It can go into the ophthalmic artery system and cause permanent blindness. That's why I showed the slide that we image before we do anything. So before you cut anybody open, isn't it a good idea to see if there is an aberrant artery or nerve? Because you never know. So look before you cut. Now, I would suggest that if she had one aberrant artery, it may be aberrant in other places. So there are options to at least warn the doctors that there's a possibility of the neuroanatomy, in other words, the nerves and blood vessels and veins not being where they're supposed to be.